Hello again. We're back and we're here to talk more about Medicaid. This video lecture will talk more about Medicaid in terms of being a secondary payer and other topics. Let's get started. And again, states are required to verify receipt of Medicaid, and this is part of overall utilization review. Utilization review is to look at patients, look at their health information to determine that they're getting appropriate care and being managed at the appropriate level of the continuum of care. We do surveillance and utilization review through a subsystem, and this kind of safeguards against inappropriate overutilization or unnecessary services. In this case, if some are flagged, there are processes in place to recover any overpayments. A big piece of this is medical necessity. Medical necessity meaning that these services are needed. So in other words, the services that are provided are consistent with all the symptoms, the diagnosis, the condition, the injuries. And these are being provided as a standard of care is a term that you hear a lot of. And these are provided for life-threatening conditions, for pain, injury, illness, or infection, or to treat conditions that could result in any physical or mental disability. Services are payable when they're determined to be medically necessary. And again, very straightforward stuff. This services are not provided for the convenience of a recipient or a provider. They're provided when needed for life-threatening conditions, severe illness, or injury. Again, skipping ahead to this, why do we do utilization review? We basically want to require states to verify the receipt of these services, that they're actually being provided to patients who need them, and to make sure that they're getting appropriate services. We're not just providing services as kind of a revenue stream for a provider. And this involves usually post-payment review, retrospective reviews, and processes in place to identify overpayment. And again, like we've seen before with our Medicare, we have claims forms, and these involve the 1500 form for physician services and the UB04 for institutional or facility charges. One thing that a lot of providers are very chagrined to find out that the Medicaid programs insist on timely claims submission. If you don't get your claims submitted on time, you will lose revenue. And the deadlines vary from state to state. In California, it was typically 6 months. But again, these change frequently and they vary from state to state. And like other payers, we accept assignments. In other words, providers accept the assignment, right? And we have deductibles and copays. And then again, this is where the financial counselors come in. If people can't afford the copay, there are other things that may be available to them. And again, these will vary from state to state. More on Medicaid billing. There is typically major medical or what they call accidental injury coverage. In other words, when there's liability insurance in addition to Medicaid, that will also come into play. The Medicaid eligibility is based on the income. So patients are eligible 1 month, and if they have a good month of income, they may be ineligible the next. Medicaid cards are issued for unborn children of, and they're only good for the services for the unborn child. And again, like any insurance, once payments made or a claim is submitted, there is a remittance advice. Medicaid primary claims instructions are followed when the patient isn't covered by additional insurance. So in other words, if all they have is Medicaid, then there's a certain set of instructions. Many patients will have both Medicare and Medicaid, and there will be crossover claims instructions that a medical office will have to follow. And again, as we see, just like in ICD-10 coding, we have the mother's chart and the baby's chart. If you can remember back, for those of you who've taken ICD-10 CM claims. So very important to keep your claims straight, because there's a claim for the newborn services and claims for the mother's services. In the case of a newborn, infants of Medicaid recipients are automatically enrolled on Medicaid for the first year of life. And again, with CHIP, each state would select a payer that administers the children's health insurance program, and the payer, in other words, which acts as the middleman, if you will, for Medicaid, would develop its own 1,500 claim instructions. So again, as you think about Medicaid, some of the more important things to make sure that you're clear on for the purposes of this class and beyond are, what are the eligibility guidelines? These vary from state to state, and with state and local governments having more financial constraints on them, there is always a back and forth push to cutting back on services and getting more services. Think about which services are considered mandatory for Medicaid beneficiaries. And then think about what are some of the reimbursement policies. That's all I have for you. We'll see you online. Bye now.